Healthcare saves lives. Unfortunately, abortion healthcare for women is in jeopardy. In cases such as incest, rape, mental health, and the well-being of the mother, abortions are healthcare, and they should stay protected. I have received an abortion due to the likelihood of it killing me, and the abortion saved my life. I have also become a mother by choice and will continue to speak for women and the rights that are being threatened. Having an abortion is healthcare for all cases, especially cases such as incest, rape, mental health, and well-being of the mother and the fetus. We will break down this argument and look at different areas of the abortion debate, how abortion can affect women long-term, how abortion is looked at morally, and finally, how limited abortion access damages women's healthcare. The topic of abortion is heavily debated. Many sides of the argument come from personal beliefs and views. Through discourse and communication, and breaking down the argument as a whole, we will be able to look through the complexity and hopefully be able to stand up and defend women across not just the United States, but the world. First, let's look at how abortion can affect a woman long term. Abortion healthcare has been researched and looked at many times to discover the long-term effects abortion has on a woman's body. In order to understand that the idea that abortions are safe or are damaging long-term, we have to look at the studies that either agree or disagree with this statement. In the journal The Safety and Quality of Abortion Care in the United States, it was found that the community did not find well-designated, designed research on abortion's association with future ectopic pregnancy, miscarriage or stillbirth, or long-term mortality. The safety and quality of abortion care in the United States. In fact, some of the data suggested that an abortion could actually help the chances for future fertility and decrease the chance of ectopic pregnancy. In another study done in the safety and quality of abortion care in the United States, it was found that the committee identified high-quality research on numerous outcomes of interest and concludes that having an abortion does not increase a woman's risk of secondary infertility, pregnancy-related hypertensive disorders, abnormal placentation after a D&C abortion, preterm birth, breast cancer, or mental health disorders, depression, anxiety, and PTSD. This shows us that abortion has no long-term physical effect on a woman's body and is safe when done properly in a medical facility. Equally important is how and why abortion is perceived as morally wrong. Abortion is often looked at as morally wrong and is an argument used by those who oppose abortion access. In this sense of healthcare, abortion can save lives for medically necessary and even save lives for those struggling with the conception of the fetus based on rape and incest cases, as well as cases for mental health. The Pew Research Center presented an article that distinguishes who perceives abortion as morally wrong. In many of the statistics, 49% of people within the United States thought that abortion was morally wrong, as well as 28% of religious people thought that abortion was morally acceptable. Pew Research Center. Abortion can be perceived as a moral issue when we look at the reasons that abortions are needed and things get complex. For example, in the result of a miscarriage and the fetus isn't able to be properly passed, a D&C is offered and performed to avoid complications such as sepsis and is considered an abortion. Mayo Clinic. This procedure is life-saving and is done to prevent women from dying or being seriously ill. The question of mortality of an abortion does not lie within healthcare. Often women in these situations, like me, do not get a say in whether or not they receive this care or the abortion, it can endanger them without an abortion. And this is a huge, huge mental toll for many women who receive a medically necessary abortion. I know, I carry it. Healthcare is a life-saving treatment which an abortion offers. If procedure betters the life of the person involved, then it should remain protected and legal. Finally, let's discuss how restricting access of abortion can really hurt women's healthcare. Access to abortion is very important for more than one reason. During the time when abortion was illegal, many women tried to do dangerous and fatal ways of performing their own abortion, which caused a high maternal mortality rate. The abortion procedure has now been perfected, and there are many ways a woman can receive an abortion safely. Some ways can include a D&C, abortion pills, etc. In the article, Why Restricting Access to Abortion Damages Women's Health, this is said in the years following. The 1973 Roe v. Wade decision, numbers of reported deaths associated with illegal abortions defined as though performed by an unlicensed practitioner declined, hovering between 0 and 2 deaths from 1980 to 2018, down from 35 in 1972 and 19 reported in 1973, showing the effect of legal abortions had on the maternal death rate and how they declined. However, after the overturning of Roe v. Wade, these numbers are expected to rise again. Legal abortions should be protected not only for the safety of women who need them, but for the safety of women who want them. The article, Why Restoring Access to Abortion Damages Women's Health, also had this to say. Placing undue hurdles between women and access to abortion care is associated with undesirable outcomes, which is true. Limiting access to abortions can cause a rise in maternal death, as it did before abortion was protected and done safely. Abortion is a safe procedure that helps the quality of women around the world's lives. Abortions are essential health care with no proven long-term effects. The moral view of an abortion has no place in the quality of women's health care, and restricting access to abortions only harms women's health and safety. Abortions should remain protected in cases such as rape, incest, mental health, and well-being of mother and fetus. I want to leave you with this. I was lucky enough to receive an abortion before the overturning of Roe v. Wade. If I had needed one after, I may not be writing this speech to you today. Thank you.